nursing shortage, early retirement, and aging. One of the main issues currently with nursing shortage is the retirement of older nurses. There are many nurses that are retiring early, causing a nursing shortage. Some of the reasons older nurses are deciding to retire is due to aging, having personal health conditions, not feeling valued, being stressed with work, and realizing after the pandemic how hard it was to care for others due to having such a high nurse-to-patient ratio and not having the support needed during those rough times. Older nurses retiring creates an issue because it will leave the healthcare system even more short-handed. Some of the reasons of why they're leaving healthcare is due to being overworked, working longer than 40 hours a week, which leads to burnout and being short-staffed. If this is not addressed, then it could cause issues such as medical errors and be a patient safety hazard. Nurses that are burned out tend to make more medical errors and also do not focus on patient safety due to being tired and stressed. Personally, this makes me anxious because as a new nurse, it can be intimidating to come into the healthcare field and not have a mentor that would guide me and teach me how to perform certain tasks. Sometimes this leads to work overload because as new nurses, we are still trying to get used to the work environment, and it takes us longer to perform certain things. This could make us feel stressed and depressed. Being a new nurse and not having the proper guidance could be discouraging and cause us to feel disconnected from others. Older nurses retiring not only affects the United States but also affects other areas of the world. It decreases the well-being of the population because nurses tend to teach patients how to care for themselves and assure they enhance their health. Having a shortage in nursing also compromises training that could be done to enhance patient health, compromising the quality of health services. Older nurses provide many advantages for the healthcare system. They have been practicing for many years. This helps them provide and perform effective knowledge. Since they have been around for so long, they know what works best. They also have been able to assure that they provide safety and quality cares. They have seen the downside of what can happen if safety is not applied when performing cares, so they assure they practice this when helping patients. If older nurses could be given the role of mentors for new nurses, it would decrease their burnout and it would also benefit new nurses in the healthcare system because they would be teaching their skills. This could also remove some of the burnout they have by being able to teach, advocate for patients, and mentor. So how do we solve the issue? Well, some of the ways to retain older nurses are by valuing their experience and making sure they also get compensated for their knowledge. If we do not pay our nurses what they deserve, they will eventually leave and not stay. Another way to solve the issue is by allowing them to have a flexible schedule. Perhaps giving them the opportunity to perform part-time hours versus full-time will help them feel less stress. We could also teach them how to manage their stress. Managing their stress will help them with their burnout and the feeling of being undervalued and overwhelmed. Also, if companies provide better retirement plans that are also easy for nurses to understand and access, it would be helpful for them to identify when it would be more convenient for them to retire. Having the proper communication between nurses and leadership is also essential. Nurses that are able to communicate with upper management and leadership provide better patient safety. This encourages them to also perform better, and it will encourage with sustainability because if they're able to talk about their concerns and be heard, they're more willingly to work and stay longer for the company that they're working for. Being able to discuss concerns and issues with your nursing supervisor or director promotes retention of staff. Some other fun nursing facts are that currently, nursing students are the ones that make up more than half of all the health professionals. There is a high demand currently and it will increase in 2030 for RNs. There's only over 2.9 million nurses in the US. Also, in the next 10 to 15 years, more nurses will reach retirement. And lastly, more than half of the RN workforce currently is over the age of 50. In conclusion, to be able to help with retention of older nurses, we must focus on the proper nurse-to-patient ratio. This will provide safety of patients and reduce nurse burnout. We must also help them find ways to cope with stress, value their experience, and help them get mentored or teaching jobs to promote a safety work environment for them and patients. Compensating them well and educating them and helping them to find the proper retirement plan will also be beneficial for them.